Okay, we'll kind of get started here. The good news for all of you guys, this is going to be a super fast class. This Monday's class and today's class, the lectures were intended to be split into two because it was a really big chapter. And I didn't do a good enough job relaying that to the previous instructor. So when I went on last night to figure out where he left off and where I need to pick up, he'd covered the entire chapter. So there isn't a chapter we have to cover today, which is good for all of you guys. The only thing that we actually had to cover today was just talking about the joint immobilization and long bone. And so all we're going to do for that is we're going to do just a couple really short videos showing people going through the National Registry Long Bone and Joint Station, just to make sure you guys remember what it was like, because you guys have to go at least through one of those or potentially one of those with the random. So we'll go over that. But I was going to initially just cancel the class because I didn't think that was enough to go over. But I've been getting lots of questions and emails and texts about people asking about the test. And so I wanted to make sure I had a chance to talk to you guys about that. So that's really the most important thing I want to go over with everybody today, as well as making sure I field any questions people have about the clinical experience. Have any of you guys done the clinicals yet? Okay. So with the clinicals, make sure that preferably prior to the morning you go in to do your clinicals, especially if you're going to do it as specialty procedures. If that's your first clinical experience, try to go to the hospital ahead of time to go get your security badge. And then you will just keep that badge with you until you're done with this class and done with both of your clinicals, and then you'll turn it back in. You don't have to turn it in that day at the end of your experience. And the only reason for specialty procedures is because they want you guys there at 7 o'clock in the morning. It's 7 to 2 with specialty procedures. I'm just not 100% sure what time the security office opens in order to get your badge. So if you wait until that morning, you might delay getting to specialty procedures early. And in any of those kind of areas where they do scheduled procedures, first thing in the morning is where you're going to have your biggest opportunity to get the most IVs, because everybody coming in is going to need an IV prior to their procedure. So trying to be there on time is important for that one especially. It's not as critical for the emergency department because they want you guys there 11 to 11 in the emergency department, so you'll have time that morning to go to security and get your badge if you hadn't done so. Some people have been asked where the specialty procedures unit is. It's the unit on the first floor, kind of right behind the ED and X-ray, up against that back wall. We go there quite a bit for getting patients in and out of there for CTs that have gone there for like a gastroscopy or something. But it's first floor, straight back behind the ED. They used to be called short stay, now specialty procedures. So that's where that is. Questions from you guys, or if anybody has any questions off-site, please type it in about the clinicals.
So where's the security office do that?
I should have looked into that. I didn't even look into that. I know there's been a couple people that have done clinicals, so if anybody off-site has done clinicals and picked up your badge, just please answer that where that is. I know there's a little security one in the lobby of the ER, but I don't know if that's their main office. It's probably in the building behind the hospital.
Yeah, so I've done it for the OR. So on the north side, there's a separate building. It'll say human resources.
Yeah, but this is one right behind the main building.
On that northwestern corner.
Okay.
You walk into there and go to human resources. The visitor section? What's that, through the visitor section? Sure. No,
it's a separate building from the main hospital. It's where it's a new building they built a few years ago with the hospital's administrative offices and so.
But if you guys, they have signs up like from the parking lot, stuff like that. So follow the signs.
Okay, and Eric, to answer your question, is there anyone in particular we check in with? Each unit has been given a list of our students that are going to be there that day. They know we're coming. I don't know the procedures that they have as far as who they're going to assign us to. I kind of just with the emails I've had back and forth with specialty, it sounds like they're going to try to have you hop from room to room to room to room to room to where you get the most IVs. So just show up, tell them whoever you happen to see first thing in the morning that's wearing a hospital badge in that unit, just let them know you're an EMT student, you're there to do IVs, and they'll hook you up with whoever you need to. So hopefully that's all taken care of on their end, but I don't know. There's not a specific name that you check in with. And then same thing with the ED. When you show up there, just find the charge nurse and let them know what you're there for, and they'll get you hooked up with the nurse or however they're going to do it. It's not like some clinicals where, you guys are being graded on things or being expected to do so many different things. The ER one, if you guys can do IVs, if you get the opportunity, great, do the IVs. But part of it's just also the experience of just seeing how they do things and what they do and more patient care. And so it's nothing you're being tested on, graded on. There's not an evaluation that has to get done on you. This is just purely for your experience. And then same thing with specialty procedures. You're just there to try to get more sticks. And the only reason we have you go to specialty as opposed to the ED twice, pretty much everybody in specialty procedures is going to get an IV. Not everybody in the ED gets one. So oftentimes you can get more IV sticks in a place like specialty than you can in the emergency department. Okay, any other questions about clinicals? Actually, okay, if you guys don't have any other questions about the clinicals, we'll start talking a little bit about the test.
Question.
Yeah.
Should we wear?
Oh, good. What to wear? Just wear your uniform. A lot of the Coeur d'Alene guys are asking, is it just the t-shirts, the red polos, or Class Bs? I don't really care. I'm fine with you just wearing a t-shirt. As long as you're wearing a uniform with something that says what department you work in, I don't care. With the county guys, follow whatever your guys' policy is on doing that kind of stuff. If you don't have a policy, it doesn't really matter to me as long as you're wearing a department uniform. But for Coeur d'Alene guys, I don't care. T-shirts are fine. So, probably looks more professional, but shoot. Most of them are going to be in scrubs, which don't look professional either. So, I really, whatever. Okay. Any other questions about clinicals? And you did yours? Which department? I forgot. How'd it go?
Okay, how do you get that?
Was it not a lot of procedures going on that day, or? Okay. Any feedback for anybody else going there?
The catheters are different, so technique's a little different.
Do they still? Are they having? Is it a push button one, or what are they using now for the
breakaway? And they let the butterfly wings on them.
Okay. Yeah. So that is one thing I was going to mention. I completely forgot a little bit ago. In the morning after you check in, ask them if you can look at the IV kits that they use, because I guarantee they're different than ours, and they even might be different even yet again when you go to the ER. I don't know, but have them show you what they're using. Were they using lidocaine injections?
No.
Good. That'll make it easier for you. I know a lot of the departments in the hospital now are they'll give the patient a little teeny tiny sub-Q injection of lidocaine prior to the IV stick. And like when I worked up in pre-op for the OR, that was expected. Pretty much everybody, unless there was some reason we couldn't give it, was getting lidocaine prior to the IV sticks. I thought it was kind of a joke because most people complain just as much about the lidocaine because it stings as they did the IV. But that was just their policy up there. So the bad thing about you're right, iodine, and then the bad thing about the lidocaine, you get this big bleb all of a sudden above where you're looking at your vein, and now you've completely destroyed what you're looking at. Now you're basically just going by feeling, which is fine. I go by feeling most of mine anyway, but I know a lot of people like to see where they're poking. All right, the test. One thing about the existing tests, guys, I know a lot of these questions are absolutely ridiculous and they suck. I get it. It is what it is. I only have so many questions I get to choose from each chapter, and my thought process is the more questions I can give you without making it ridiculously long, the more you can miss and not have it affect your grade as much. And so a lot of the chapters, I'm using every one that they give me on these tests. All the options I have, I'm dumping them all in there to get up to the 20 questions or whatever I'm putting in there. So my plan for the final is to be a little bit more selective. I have the ability to go through, and it's really tedious. It's kind of a pain in the butt, but I'll spend the time to do this. I can go through every test you guys have taken, and I can see the questions that people are getting, right the first time or having to take or missing the first time. Now, I think it's lumping everything together, all your attempts. I think we're getting all lumped in together into one big query. I don't think I can separate out the first attempt or second attempt versus third attempt, but I can see which ones people are just getting right and which ones a lot of people are getting wrong. I'm going to go through, and all the ones where a whole bunch of people are missing a question, in my mind, I think it's probably a bad question, not a knowledge-based problem, if most of the class is missing it. So I will not choose those for the final. So I will go through and try to pick out ones that most people are getting or being successful on. And if I have time, I'm going to then try to go through and read them all to make sure they sound good to me. I don't have tons of time over the next few weeks, but hopefully I'm leaving to Bolivia on Tuesday. When I get back from Bolivia, I hope to spend more time actually reading test questions. But they should be, cross my fingers, better than the ones you guys are having from each chapter. As far as number of questions, I don't have a set 100%. This is how many test questions are going to be on the test, but I'm thinking 2 to 3 questions per chapter is kind of how I will pull those.
Are you saying that we're going to be familiar with the questions?
Yeah, pretty much. There's a few chapters that had more questions available to me than others. So, I mean, some like the cardiac chapter, there was like 70 questions in that chapter. So some of the bigger chapters had more test questions. Some of them had, I mean, you've had a couple quizzes that only had like 15 questions. That's because that's all I had. So I can't say I'm going to 100% give you all the ones that you've seen, but by a far majority, they're all going to come off of the old tests because I just don't have very many. I don't have that many to choose from. I did have a question this morning if I can open up the tests again to let you guys go in and study them. I don't know. I will look into the program to see what I can do to open it up. It may allow me just to reassign them where you guys can go in again and attempt to take it. But I don't know if I can open it up where you can just view it. I don't know. I'll look into it. But if I could only open it up for another time you can take it, I'll open it up for another attempt. You guys don't have to go in and do another attempt. I guess if you really needed to, you could. But I will see about that. I haven't looked into that on the programming side of that. I don't know. But I'll try. Have you guys gone into that testing field and tried to view tests? Can you go and see them at all?
Like each chapter?
Yeah. Once you take it, can you go back into it?
So you can review it after you take it. Once you hit finish review, I don't believe you can get back into it.
So, yeah, I don't know. So you guys can look into it a little bit more on your end. I'll look into it on my end.
So, I mean, if we can review them, then I don't think you need to do, I haven't tried to go back in and actually open it up.
I had tried to point, maybe I didn't know, I didn't see it really made it obvious that you can get back into the test, but maybe.
So will a couple of you guys try that later today or tomorrow and let me know?
Yeah.
But then I will also look at it my end. But if I don't need to open everything back up, there's no point to do it if you can review them. So yeah, just please look into that and get back to me. If I need to, I will do it. I don't know what I'll do, but I'll try to do something from my end if I have to. Okay. Okay, what other questions do you guys have on the test? I think what I'm going to do, well, the final exam is going to be in-house. We actually have a day scheduled to do the test here. Because this whole class was set up as a hybrid class, it's just like every other class. I'm not going to make you come in here to do the test because a lot of you guys will be on duty. And so if you're on duty, you're on duty. It's going to be just like the other tests. It's going to be online. And I hesitate to do this, but I think I'm going to just because I haven't seen the test questions, and I don't know if I can get all really good test questions. I'm going to do my best. I'll probably do the exact same thing with I did the other one where you'll have multiple attempts. Probably do 3 just like you did before. That way, it makes me feel better about having it not be a knowledge-based problem that has a problem rather than a stupid test question thing be the problem. But again, now here's the deal, guys. I mean, yes, you have to pass this class with, what do we say, 70%? I have to go back and look at the paperwork, but to be completed so you can take the national. If it takes you guys 3 times to get through the final, and it's because of a knowledge deficit on your end, not a question deficit, then you guys got to buck up before you take your national registry test, because you still have to pass that, and I have no control over that. All right. Any other questions on the test? Okay, and Pete, is everything still good on our end for the practical in April, as far as we know? Okay, so we have confirmation on the practical date from the state. They have somebody, I don't know who it is yet, scheduled to be here. We're working on all the finalized stuff on our end, but that should be a go. With that being said, the National Registry application process you guys all had to go through, thank you all for doing that. You all got registered, and I went through and I marked all of you guys eligible for early testing. It's kind of a weird thing between the National Registry and the Idaho EMS. They actually wanted me to go through and mark all of you guys off as eligible to test early. Even though you're not testing till the class is over, Idaho has to do a bunch of stuff on their end before April. And if I didn't mark you guys off as early eligible, they couldn't get their stuff done on their end prior to the April test date. But what they need to complete the stuff on their end is the letters that you guys receive from the National Registry, the PAAT or PATT or whatever that letter is, the permission to test letter. You have to get those to me as soon as you get them from the NREMT, because I have to get those to Idaho EMS. If they don't get those in time, you won't be eligible to test in April. So far, I only have one of those from a student. I don't know if it's because you guys just haven't got them from the National yet. They said it could take a couple weeks. But if you've received that in your email, please send it to me. Yeah, just forward it to me. I'm going to try to lump them all into one big email to send to Idaho. I think there's less likely that they will miss some if I'm just, rather than sending a whole bunch of them. So yeah, forward them to me. I will lump them into one big file and send them to Idaho EMS. Questions on that? But thank you guys for all getting that put in. That's all of you guys have been checked off, and that's all been submitted. You haven't got the letter yet. Okay. Yeah, you were the first one, weren't you? So I've only gotten one that I got a couple days ago. So, and I've let Idaho EMS know that it's all been done on our end, and we're just waiting for the National Registry, and it's kind of out of our hands now. And if it doesn't get done in time, I don't know what'll happen, because we've completed the process within the dates that Idaho EMS requested it. So I don't know. We'll play it by ear. I think it'll be okay. I'll just cross my fingers. All right. Okay. Any other questions? Okay. I hated to bring you guys all in for that basic information because I know it wasn't much, but I do want to. We're just going to play these couple of videos. They're like 6 minutes each. Just watching the testing process that you guys have to go through for the joint and the long bone. Now, how'd the skills day go Saturday? Did it go good? Did you guys have a lot of time to practice your skills? Okay, the next one is this coming Saturday, correct? Pretty sure? So we'll add the long bone and the joint in there. But please, just make sure, other than just doing your skills, also be reviewing your skill sheets, because that's what you're testing on. And that brings me up to another question I had this morning. I was asked when we're going to cover I/O in the class, because that is something you guys are allowed to do. And I don't think we actually had any time where we are going to cover I/O. And I had to look into it, but I'm almost positive you're not tested at all on I/O. But since you guys can do it at this level, it's probably a good idea that we cover it in this class. So that was kind of I just missed it because I built all the skill stuff kind of around what you'd be tested on. And that one just slipped through the cracks. So I will look at a time in the schedule when we have a smaller lecture day or whatever, and we'll throw, or we'll maybe just do it during one of the skills weekends or whatever, but somehow we'll throw I/O in too, so you guys have a chance to actually do that skill before you get done with this class, even though I'm almost 100% positive you're not tested on it. Okay, any other questions? No, let's not do it. If you haven't been trained on it at all, don't do anything in the field that you haven't been trained on. Now, for the I-85 guys that have already gone through the optional modules stuff for IOs, they can do them because they've already been trained. But for you guys, not. You either have to wait until we train here and do it, and then do it under a precepting rule. And then if something happens and you miss the training for IO here, and due to calls or whatever, at the end of the class, we just have to make sure that you are taught by your department, and then you'll be good to go. All right, the first little video is joint. Oops, nice. Hey, Pete, is it this for the volume, or is that going to affect them?
Scene sizing and primary survey are completed, and the suspected injury to the right shoulder is discovered during the secondary assessment. Continued assessment of the patient's airway, breathing, and central circulation is not necessary. You may use any of the equipment available in this room. You have 5 minutes to complete this skill. Do you have any questions?
So I make
So I'm gonna have you hold manual stabilization and keep your arm comfortable.
I'll get rid of all this stuff.
While you're doing that, let me get this out. First, before I apply it, I'm gonna check CMS. Check status.
Yeah.
Motor, sensory, and circulatory functions are present and normal.
What I'm gonna do is place this on.
You guys make sure I got you guys.
Still. Access.
Okay, so that's the long bone and joint skills stations that you guys will be potentially going through with the random stuff. With the long bone, remember they could also throw a traction splint at us. So during the skills practice day this weekend, I'll make sure that you guys have like the SAM splints as well as the Kendrick, because we actually don't know. We don't know what random they're going to have or what kind of injury they're going to have until the day of the test when Idaho EMS comes and says, this is what you have. They tell us what supplies we have to have available, which is pretty much anything that they could potentially throw at us. And we don't know until that morning what it's going to be. So make sure you practice that you're comfortable putting on the traction splint as well. Most of the time, knock on wood, they don't use traction splints because they take too long for a testing day, but they could. But more likely it'll be a, humerus or radius ulna or tib bib or who knows. But for the joint immobilization, again, it could be any joint. I have never seen them use a lower extremity for a joint. I've always only seen them use an upper extremity, but technically it could be any joint. So questions on those particular skills. And again, we're not going to do the hands-on stuff today. We'll do that this weekend. But questions on the skills station part of it? Like, you guys have all done those before. You're basic, because those are basic skills. Okay, before we end, again, for anybody that that's off-site that showed up late, just so you know, we're not doing a lecture today. The lecture for today was already covered on Monday. Monday's lecture was actually intended to be split up into two, but they powered through and did the whole thing in one day. So I went to review to see what I needed to cover today for the lecture and saw that it was all done. So with that, you guys are going to get a bunch of, and I know a whole bunch of this class is also quite a ways behind in chapter tests. So this would be a great opportunity to spend a couple hours trying to catch up a little bit on your chapter tests, because this class is wrapping up fast. And I know we have thrown these chapters at you really, 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 really fast. I had never been involved with an advanced class. This was a first go around for me. There's been a lot of feedback where it would have been nicer to spread this out over a longer period of time, which next go round, well, that'll probably happen. You guys were, kind of the guinea pigs for this, for better or worse. And I know it's been a lot of information super, super fast, but we're too late to change that now. We're kind of stuck with what we've got. So, but I do understand it's been a lot of information really, really fast. Initially, when we were developing the class, the people we talked to they didn't want it to be over a big period of time. They would prefer it to be a few months, pound it out, get it done. But it's easy to say that when you're not in the book reading and trying to comprehend it all. So I get it. This is a ton of information. So, sorry about that. But all right. Otherwise, if there's no other questions, you guys are free to go.
Something we can come up the previous test.
I think you can go back to the viewer.
That's what I thought.
That's what I recall.
I tried to log in here.
It's one thing to listen to a lecture on speakerphone while I'm driving. I'm not
Just got them to log in.
Okay.
It doesn't seem